Bob Menke grew up in Greenville. His family still lives in Greenville on their family farm. He went away to school. He became an engineer, came back to the Versailles and Greenville area to have his family, has 3 lovely children, and he came back to work at Midmark Corporation. He was an avid runner. He inspired his daughter Lauren to go into cross country, and she loved running with him, and that was something they got to do together.
So when I was in 7th grade, my dad and I went on a 4-mile run together. It was something that we did really often. We'd run around the country block near our house. But this time when we got back, my dad collapsed. After that, I ran inside and called 911, and we waited for the ambulance to come. A little while later, my family and I drove here, and that's when my grandpa told me outside the hospital that my dad hadn't made it. That rest of that week is kind of a blur when I was 12 years old and trying to wrap my head around everything.
I think it was just very shocking for everyone because he was 38, he was healthy.
He didn't smoke, didn't drink excessively. We ate our fruits and vegetables, and he was also very active. We ran together. He had trained for a half marathon a couple years before. All things that check a good bill of health. What they found when they did the autopsy is that there were blockages in his heart that had gone completely undetected. Most of the time, if people have blockages in the heart, they start feeling some chest pain, but some people can go undetected. And those blockages can build up because of poor lifestyle or dietary choices, but also some people just have a genetic predisposition.
The family kind of came together through Bob's legacy and memory to say, hey, how can we help others? How can we get them to see that these screenings are very important, to go to their local hospital and get those done, whether they're 18 or they're 45.
By being able to identify those individuals who may be a higher cardiovascular risk at a younger age, it allows us to work together to try to reduce that risk and hopefully prevent future events or reduce the amount or severity of those events.
And so we put a committee together with Midmark, the Menke family. Bob's dad, Tom, was very involved. And that is really how the walk started. And they wanted to do something where they could raise funds to truly discount these vascular screens, because the main focus was, how do we spread awareness? How do we get people back to do these and save lives? And we've been very fortunate since we started doing this. We've screened about 2,500 people. About 1 in 3 come back with something that they need follow-up on that they probably didn't know before. So that's about 850 lives that hopefully we've changed for the better, got them on a new track. But it has been fun to be part of this walk-run event and to start the new Bob Menke Heartwise initiative.
I don't want other families to have to live without having one of their parents there, missing those key moments in their life, whether that's the father-daughter dance or graduations, to have those family members there, and not only there, but also living in good health.
He's been that inspiration behind all of this. He's inspired Midmark Corporation to get involved and start the walk that we have done, the 4 Miles for Heart and Health, to give back to the hospital and to start our discounted and free vascular screening program. He's inspired his family to really want to help others and to save lives and to say, this doesn't have to happen to other families, and how can we change that process and that outcome for the better? And they have decided that they're going to match $50,000 that we're trying to raise here for the community. We're very blessed and honored that we get to do this with them.
They've taken a very personal, tragic event in their own family and really worked hard at trying to make sure something similar doesn't happen to others in the community.
What his children want is just to truly honor his life, honor the light and fun they had with him, and be able to give that to other families for a long time. So being able to keep them healthy, hopefully save lives, those families can shine with the light that was maybe dimmed a little too early for Bob.